Polynucleotide treatment has taken over the aesthetics world with incredible claims such as anti-aging, with amazing eye transformation results, managing hyperpigmentation and melasma, improving skin hydration, and more. But what is it? How does it work? And does it really do the things that people say it does? And stick around for the last part because the science behind it is really interesting. My name is Ali and I joined Dr. Haller Medical Aesthetics back in 2017 after graduating with a first-class degree in biomedical science from King's College London. Unsurprisingly, I love the science behind these skin treatments, and if you're watching this, then I hope you do too. So click the subscribe button below to see future videos learning more about the science of how the skin treatments you love to get actually work. But for now, what is polynucleotide? Polynucleotide is an injectable skin treatment with a gel-like consistency similar to that of Profiler. It's made using salmon and trout DNA, and yes, it is made using fish sperm. Salmon sperm? I don't want salmon sperm on my face, but it's really not like that. This DNA extract is purified, filtered, and sterilized, so the end result is not too different than if you would extract DNA from saliva or blood. And you wouldn't say DNA extracted from blood is blood, would you? These DNA extracts from fish are very, very similar to human DNA, which is crucial, but we'll come back to this a bit later. To be honest, this whole salmon sperm injectable really comes across as more of a marketing gimmick, which is a little bit weird, but it worked. So who am I to judge? Everyone is talking about polynucleotide. To really understand how polynucleotide treatment works, we need to dive a little deeper to the cellular level, and I'll see you there. You are the product of your DNA, and your DNA is formed of a chain of molecules called nucleotides joined together to form the building blocks of DNA. And these nucleotides in a long chain are called polynucleotides, poly meaning many, nucleotides. And that's where the name polynucleotide treatment comes from. Your genetic code is essentially an instruction manual for your cells to create certain things like proteins. Let's take collagen, for example, which is the most abundant protein in the human body. A specific part of your DNA contains the instructions to create collagen. When needed, specific cells such as fibroblasts read these instructions and go through a multi-step process with the end product being collagen. This is really important in things like wound healing, but maybe more importantly for the topic of this video, in maintaining your skin's structural integrity to keep you looking as young as possible for as long as possible. But as we age, our fibroblasts become less and less effective and collagen levels begin to drop. And that's when you start experiencing things like fine lines and wrinkles, and that's where polynucleotide comes in. Do you remember how we said that the DNA fragments from fish are very, very similar to that of human DNA? This is why it's so important, because your cells actually recognize and can read and act on the instructions in these DNA fragments. So when you have polynucleotide treatment and these DNA fragments enter your cells, they will read the information and begin to make things like collagen, for this example. Increasing your collagen production then improves your stability and scaffolding in your skin and reduces these things like fine lines and wrinkles. This makes polynucleotide something called a biostimulator. It stimulates your body to produce something such as a protein like collagen and gives great effect. Moving on to the results of polynucleotide, what can you expect, and does it actually do what people say it does, starting with anti-aging? Yes. When you have polynucleotide treatment, your fibroblasts will begin to proliferate or grow, which means you have more and more fibroblasts acting in your system. They are also activated, so you produce more and more collagen and begin to repair and restore that structural integrity to get you looking more youthful by reducing things like lines and wrinkles. This same mechanism also helps with acne scarring by replacing the lost collagen in the indented acne scars. But collagen isn't the only thing that polynucleotide stimulates your cells to create. Your fibroblasts will also begin to create more elastin and hyaluronic acid. Elastin is also crucial in maintaining the integrity of your skin and keeping a youthful appearance and helping your skin stretch and snap back into position so it doesn't become loose. And hyaluronic acid comes into play when we talk about the hydration effects of polynucleotide. See, it's been claimed to be an incredible hydrating treatment, and it really is. Because of that, because you increase the hyaluronic acid production from your fibroblasts. Now, hyaluronic acid is really, really important for retaining water in a good way. It helps your cells hold on to water that they need to make your skin more hydrated. Hyaluronic acid actually can hold up to 1,000 times its molecular weight in water, so even small stimulation of increased hyaluronic acid production can really, really help. Pigmentation reduction and melasma management is also a big claim for one of the benefits of polynucleotide treatment. But does it actually work? Surprise, surprise, yes, it does. Polynucleotide will actually help to reduce pigmentation and manage melasma by reducing the production of melanin in your melanocytes. And that's the issue with hyperpigmentation or melasma. Your melanocytes, which produce melanin, overproduce it, and there's an excess in specific areas of your skin. And that's what gives your skin the darker patches, characteristic with melasma and hyperpigmentation. So if you can reduce the production of melanin, you can also reduce that patchy pigmentation. Polynucleotide can also improve blood flow to the area treated and improve the health of that tissue. Yes, this is another claim that is true, and it does so by increasing the production of something called vascular endothelial growth factor, or VEGF for short. This growth factor can be responsible for creating new blood vessels, which will improve blood flow to the area that is treated. And as you can guess, any tissue that has a better blood supply will be healthier and will function better. So overall, polynucleotide does seem to be living up to the hype and delivering on the claims. But interestingly, some scientific studies have found that polynucleotide could actually be best used as a primer before other treatments like laser or needling. What that means is you can use polynucleotide to improve your skin's health and get it into a better condition to respond better to these treatments. So it's quite interesting, a little bit of food for thought for how we use polynucleotide and how it could fit into the aesthetics world in future. But there are various treatments in the aesthetics world, both new and old, that you might be interested in learning about, and more specifically learning about the science behind how it works, what it's doing in your body, and why it gives you the results that is claimed to give you. If there's anything you want to know about, any products, ingredients, or treatments, comment below, we'll get back to you and we'll make some videos discussing these treatments, products, ingredients, and the science behind how they work.